Hello everyone, welcome back to a discussion on the parotid gland. Now in this short video we are going to look at a few applied aspects of the parotid gland. Now in your clinical practice, what are the problems about the parotid gland that you are likely to face? First of all, in pediatric population, there is always the possibility of swelling of the parotid gland in mumps. Bilateral swelling of the parotid gland, not very painful, but occurs commonly in mumps. Nowadays rather uncommon because of the measles, mumps, rubella vaccine that is routinely given to children. Now we have already said that there is this tough parotidomasseteric fascia encasing the parotid gland and providing a sort of additional capsule apart from the true capsule formed by a condensation of the parenchyma of the gland. But this stiff parotidomasseteric fascia going right up to the zygomatic arch causes a few problems, in the sense that if you have an inflammation of the parotid or an abscess within the parotid gland, as this parotidomasseteric fascia is so stiff, parotid abscesses and inflammations don't get space to expand, and therefore they are quite painful. So this is one thing that you will come across. And if you do have abscesses, if you need to incise those abscesses, usually we give a lazy S-shaped incision in front of the ear, behind the ear and over the mastoid, and then from this incision the attempt is made to evacuate the abscess material. If you have to actually cut over the substance of the parotid gland, it is preferable that you give a radial incision so that you don't vertically cut through the branches of the facial nerve or the parotid duct. Now if you do cut through the parotid duct, either surgically or as a result of trauma, what will happen is there is likely to be a salivary fistula, and that salivary fistula will cause a constant oozing of saliva onto the face with considerable discomfort and damage to the skin. In that case, of course, a primary repair has to be attempted after cannulating both ends of the ducts, and if not feasible, then an additional opening has to be made inside the vestibule of the mouth from inside. Now stones within the parotid duct are not common, but you can have strictures. If you have a stricture of the parotid duct, then after every meal, at the time of chewing and stimulation by the food, there will be a swelling of the parotid gland because the salivary secretion will be accumulating over here. Not only that, if you have a traumatic injury of the parotid gland, sometimes what might happen is the secretomotor fibers of the auriculotemporal nerve that are meant to augment the secretion of the parotid gland, they connect with the sympathetic cholinergic fibers of the sweat glands and the blood vessels. So the parasympathetic secretomotor fibers during regeneration often connect with the sympathetic fibers to the sweat gland and to the blood vessels, with the result that during salivation, during chewing of food, apart from the saliva that is secreted, there is also stimulation of the sweat glands and the blood vessels, so that there is considerable warmth and sweating over the salivary gland. This phenomenon is also called the auriculotemporal nerve syndrome or Frey's syndrome. So in some places you will find that people have written that it's a cross communication between the fibers of the auriculotemporal nerve and the great auricular nerve supplying the skin over here, but that is quite unlikely because the territory of the great auricular nerve is somewhere here, whereas over the parotid is the sensory territory of the auriculotemporal nerve. So it is most likely that the secretomotor parasympathetic fibers of the auriculotemporal nerve will have cross-connected with the sympathetic cholinergic fibers to the blood vessels and the sweat glands over the parotid in case of Frey's syndrome. If it is a minor irritation, it can be managed with antiperspirants. If it's a major irritation, then you have to cut off the parasympathetic secretomotor supply to the parotid gland. That is, you might have to cut the tympanic branch of the glossopharyngeal, which we have said is the nerve supply to the parotid. Here you have the tympanic branch of the glossopharyngeal going up into the middle ear and forming the tympanic plexus. If you cut the tympanic branch of glossopharyngeal, then the secretomotor supply to the parotid gland would be blocked. So that is one way of doing it. So auriculotemporal nerve syndrome or Fraze syndrome and parotid abscesses and injuries of the parotid duct and parotid gland. The other thing that you might come across in a parotid gland pathology is the dry mouth, that is decrease or almost lack of saliva secretion. This usually happens in collagen vascular disorders like systemic lupus erythematosus or Sjogren's syndrome or scleroderma or systemic sclerosis. As an autoimmune phenomenon, you can have damage to the salivary gland secretory mechanism, and you can have a dry eye along with a dry mouth. So all the mucous glands in the head and neck region gradually shrink and atrophy, and their secretion is diminished. So there is a total dryness of the mouth with stickiness in the tongue, and because of this dryness and lack of flushing by the saliva, there is a propensity for caries of the teeth, dental abscesses, dental problems, bad breath, and ascending infection through the parotid ducts into the parotid glands. Now, parotid infections are in general very much common in elderly dehydrated post-operative cases where poor oral hygiene and dental hygiene is being maintained. Apart from all this, you can also have, as in any other organ, tumors of the parotid gland. Now, the common tumor of the parotid gland is a pleomorphic salivary adenoma. Now, although this is by and large a benign tumor, it does spread into the surrounding gaps into which the parotid gland insinuates itself, and in many cases it is possible to remove the major or the bulk of the tumor from the superficial part of the parotid gland, which is outside the plane of the facial nerve, that is outside the parotid sandwich. So if you can dissect outside the plane of the facial nerve, then in many cases you will be able to remove this tumor of the parotid, and this dissection also has to be done very carefully, and each of these branches of the facial nerve have to be protected. If you sacrifice one of these many branches, then of course it is not so much of a problem, but cutting off more than one branch will need a graft. Now, if these tumors has spread to the deeper part of the parotid gland like a dumbbell tumor, one superficial section, one deep section, then the dissection of the tumor becomes pretty difficult, and this type of parotid surgery requires considerable amount of expertise, and there is a steep learning curve, and anyway we are diverging from our topic and we are going into excessive details now, so I think we should stop here. Thank you.